Fort Erie's urgent care center, Douglas Memorial, is slated to close when the South Niagara Hospital opens in neighboring Niagara Falls in 2028. But many in the community want it to stay open, and for years now, a vocal group of advocates have said Fort Erie's residents aren't getting the level of health care they need and have called for Douglas Memorial to be better resourced and to be open for more hours. In July 2023, Niagara Health reduced the center's hours from 24/7 to 10 a.m. to 8 p.m. daily. Douglas Memorial used to be a hospital, but it was downgraded to an urgent care center in 2009. Now, for more on this issue, I'm joined now by Fort Erie Mayor Wayne Redekop. Mr. Mayor, I understand you've been speaking with local MPPs and candidates about your concerns around the closure of Douglas Memorial. Do any of them support your call to keep the center open?
Yeah, I've had an opportunity to reach out to the major candidates, and Wayne Gates, who represents the NDP, is obviously solidly supportive of expanding and keeping Douglas Memorial open. That's official NDP provincial policy, so it's nothing surprising there. My meeting with the Conservative candidate, Ruth Ann Newestig, was also quite productive in the sense that she understands the implications of closing this urgent care center and the hospital services that are available there now. So she supports the position that the town of Fort Erie takes, but that isn't conservative, official progressive conservative policy. We've been waiting to hear from the Premier with respect to that, and we're quite hopeful that we'll be able to persuade the Premier and his government that keeping Douglas Memorial open benefits not only the residents of Fort Erie, but the residents of Niagara.
From your conversations with that PC candidate, do you think you'll be successful? I know you're hopeful that you'll be able to convince the Ford government, but if he is reelected, as polling suggests he very well may be, what do you think the chances are that Douglas Memorial stays open?
We think that the argument for keeping Douglas open with the current services and expanding those services is very compelling. And what it does would provide not only Niagara Health to better serve the residents of Niagara, but it would take the pressures off of the emergency departments in Niagara. It would open up acute care beds, and there's quite a few currently occupied by long-term care patients. So that's causing the delays in the emergency department. It would reduce EMS offload delays. It would allow people greater access to immediately health care services that they need. And it would save the provincial government money and allow them to allocate those savings to something like keeping Douglas Memorial open and to improve the services to the residents. And we know that that's the objective of the provincial government. They want to serve the people of Ontario.
Now, earlier this month, Fort Erie Town Council adopted a special motion regarding this issue that I understand Niagara Regional Council is also supporting now. What does the motion say, and how did that come about?
So the motion was originally introduced in Fort Erie on October the 21st, 2024, and it basically asked for the provincial government to continue to fund Douglas Memorial even after the new South Niagara Hospital is opened, without taking any funding away from Niagara Health in order to provide those services at the new hospital. That resolution was actually supported by the City of Niagara Falls about a month after that. And, you know, if the City of Niagara Falls has the same concerns that we do in Fort Erie, that's an indication that most people in Niagara understand that the hospital system and access to healthcare in Niagara, just like across the province, is in crisis. We did present that last week to the Regional Council, and I'm really pleased to say that the Regional Council endorsed that resolution unanimously. And so we've, and that's because 24% of the people that are served at the Urgent Care Center in Fort Erie are from other parts of Niagara. They come from St. Catharines, from Niagara Falls, from Welland, from Pelham. They come from all over, and that's because the waits in the emergency departments are excessive. And so people don't want to spend the time waiting in an emergency department if they've got something that can be dealt with in an urgent care center. If you close the urgent care centers in Niagara when the new South Niagara Hospital opens, people will have no choice. And my concern would be that the wait times would continue to increase, the EMS offload delays would continue, probably worsen, there'd still be a shortage of acute care beds, and people would not get access to the health care that they need.
That's Fort Erie's Mayor Wayne Redekop. Mr. Mayor, thanks so much for joining us tonight.
Thank you very, very much for having me, Matt.